Hi, it's Adrian from Advanced Dental Artistry. Waiting for All-on-4 treatment or even waiting for implant treatment. One of the things is when patients actually start getting aggressive gum disease, what's actually happening is their teeth are actually sometimes moving, maybe they're getting sensitive, maybe they're getting gum recession, and they see changes in their mouth and the teeth sometimes drifting or moving around. One of the issues though is that when do you consider all-on-4 treatment? One of the things with gum disease is that it's probably not the right term. I mean, gums are of course inflamed and we do get problems from the gums, but what's actually happening is underneath the gums, the patient is actually losing bone. Gum disease is when bacteria actually burrow around the actual teeth and they form colonies of bacteria under the gum. But what happens is this bacteria starts to eat away at the bone that holds onto the tooth. And this is why we get the term long in the tooth, because what's happening is the gum is receding, but of course the bone is dropping first, and we see movement of the teeth, we see gaps around the teeth, and we see actually a compromise in the aesthetics because of course as teeth shift, they actually start to move into whatever position they want to move into. The issue here is that if we consider waiting too long, what's going to happen is all the bone is going to be lost from gum disease. And if this happens, sometimes there's so little bone left that it's impossible to place implants because there's no more bone to place implants. So there is sometimes a very narrow window when it comes to treatment. Generally what we recommend is for patients to actually come in for a quick consult. We would normally send them off for a 3D bone scan so we can see at what level is the bone at now. And we can see whether it's possible, one, to place implants, whether there's enough bone to place implants, or secondly, whether the patient has time to wait and maybe consider implant treatment later on. So when it comes to aggressive or terminal gum disease, the most important thing is to work out how much bone is present and how urgent is it for the patient to consider having implants rather than waiting until all the bone has been lost and implant treatment is not possible. If you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.